Good afternoon and thank you for joining us. My name is Tina T-Bone. I will be your moderator for today's briefing. Joining us today, the Honourable Ian Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon. I'm sure by now all that are watching have seen the number. 96 cases of COVID, with the majority, 90 of them being in the Halifax Regional Municipality. COVID and its variants are on the move and spreading fast throughout the province, faster than ever before in this province. We have lockdown in Halifax and surrounding communities, including schools, but our numbers continue to climb. While the majority of cases are in the central zone, we're beginning to see a concerning trend in the Cape Breton Regional Municipality. The case numbers aren't nearly as high, but we're starting to see a steady climb, and we're increasingly concerned about spread in the CBRM. COVID is in every region of our province, and it doesn't seem to want to slow down. That's why we have to. Effective 8 a.m. tomorrow for the next 2 weeks, we are announcing a province-wide shutdown. All schools, public and private, closed. All indoor non-essential services, including shopping malls, retail, and personal care outlets, restaurants and bars, closed to the public except for curbside pickup or takeout and delivery. COVID loves the indoors, so we need to shut down activities that take place inside. Gyms, pools, indoor recreation and cultural events, dance and theatre, all closed for the next 2 weeks. Long-term care homes, closed except for designated caregivers. Essential services will remain open. Doctors and dentist office, grocery stores, and pharmacies can open at 25% capacity. Outdoor businesses, including construction, remain open as they continue to follow public health protocols. We're trying to limit as much indoor gathering and activity for the next 2 weeks to try to contain COVID. We know that COVID does not thrive outdoors. That's why we're keeping some activities outside open. Golf courses, outdoor tennis courts, and all parks will remain open as long as all of them follow public health protocols. And just for clarity, you need to stay in your community. What that means, we signed an order. The order states your municipality. So you cannot leave your municipality if you want to go to a golf course, for example, or go to a park. We are advising to use your common sense and stay within your community, but the legal confines of that, for clarity, is to stay with the strict guidelines that are within your municipality. You can still travel, of course, for work and essential services outside those boundaries. Currently in HRM, you weren't able to gather for more than 5 people, but we are now extending that to limiting that to your household. And if you are a household of, say, 1 or 2 people, you can have 1 or 2 people socialize with your own household. That number needs to stay, those people need to stay consistent with that social limit, and Dr. Strang can give you more details on that as well. That is also extending to the rest of the province, so not only HRM, that's the whole province. For families with large numbers, do not add extra people to outside of that family when you're outside. We are in a critical race between your vaccine rollout and the variant. And right now, the variant is winning. We have to move fast to slow the spread. These next 2 weeks are critical. We will continue to roll our vaccine program as we get more supply coming in. But as we continue to vaccinate, we have to continue to limit our movement. It's the best way to limit our spread. Now over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Yesterday, I said we are in a critical race between the variant and the vaccine, and that's why we're here today announcing a 2-week province-wide circuit breaker. Taking a provincial approach is the best way for us to get ahead and stay ahead of the virus. We're in a different situation than we were a year ago. COVID variants require us to act faster, be firmer, and have a broader reach. Given the case numbers in the Greater Halifax area, there is a substantive risk of spread across the province. There are already concerning signs in Cape Breton of potential community spread. We need to act now. We cannot be chasing this virus. We have to be ahead of it to protect Nova Scotians, our healthcare system, and our vaccine rollout. So my message to all of you today is stay close to home. If you have to ask yourself if you should go here or do this or that, The answer is likely no. Do not look for loopholes. We all know the intent of these restrictions, and we need to act accordingly. You should not be gathering with people outside your household at all. Effective immediately, there are no indoor or outdoor gatherings allowed. You can socialize within your household, the people you live with. If your household is 2 or less people, you can socialize with 1 or 2 others from another household, but they must be the same people for this 2-week period. So many people have asked us to define what we mean when we say stay in your community. Your community is where you access essential or necessary services or products like food, gas, and medication. For the purposes of testing and vaccination, you can consider community more broadly. As the closest place to home, you can access these important healthcare services. So try to book as close to your home as possible, but if you need to go to the next town or city to access a testing or vaccination appointment, you can do that. So I think it's best to first outline what will remain open. Retail stores must close for in-person service unless those stores provide services essential to the life, health, or personal safety. So these stores can remain open at 25% capacity and include those that provide food, pharmaceutical products, medicine and medical devices, personal hygiene products, cleaning products, baby and child products, gas stations and garages, computer and cell phone service and repair, electronic and office supplies, hardware supplies, and pet and animal supplies. All other retail stores must close to in-person service and can provide virtual ordering, delivery, or doorside or curbside pickup. Provided they have an approved COVID safety plan, regulated and unregulated health professions can continue to operate. They provide important health services to Nova Scotians, but certainly those I've heard from many of those providers. It's their choice. If they feel uncomfortable, they can choose not to run their business. Weddings and funeral ceremonies can happen with 5 people plus an officiant. If the attendees do not belong to a household bubble, distancing and masking must be maintained within those 5 people. Virtual performances and classes can operate with a maximum of 5 people present. And again, distancing and masking would apply. Meetings for mental health and addiction support groups can happen with a maximum of 10 participants following distancing and masking protocols. Outdoor recreational activities, including individual sports, are allowed and encouraged, but we're asking you to stick close to home to do these activities. So play golf or tennis, walk a trail, go for a paddle, visit a park. Just do it close to home. Don't go to another community to do this activity. And certainly, as the Premier said, it has to be within your municipality. Organized outdoor fitness classes can occur with a maximum of 5 people and distancing. If you are not with members of your household during your outdoor activity, you need to maintain physical distance. So for instance, if you're in a park and you're with your group from your household, there's another household there, the 2 households need to maintain distancing. And if you are in places where distancing, outdoor places where distancing cannot be maintained, and this is now in the order, you need to wear a mask. And a good example of that, along with what we've said earlier around outdoor spaces and markets, etc., would be a crowded playground. We're getting lots of questions. So certainly kids and children and youth at a playground, they cannot necessarily easily physically distance. If they're above 2 years of age, they need to be wearing a mask. Restaurants can continue to provide takeout and delivery services. If you need services in your home like furnace repair or plumbing, those can happen provided protocols for distancing, masking, and cleaning are maintained. While public and private schools will be closed, childcare will remain open. By protecting the community around them, childcare centers can operate safely. They provide an important service, especially to those who need to go to work to keep essential services and supports running. To add protection, masking will now be mandatory for all staff in childcare settings and for children 2 years and older at all times unless they are eating and drinking. However, the order does allow for children between the ages of 2 and 4, if a caregiver is not able to get them to wear a mask, that they are allowed. There's an exemption for that within the public health order. The Department of Early Childhood Education and Early Childhood Development will be a resource to anyone who needs help accessing urgent child care. Details on how to access this support will be in the news release that will be out shortly. So if you are an essential worker who all of a sudden needs child care support and you don't have that already in place, you're not necessarily using that right now, there will be information coming. You will be able to make contact and get put in touch so you can urgently arrange the child care that you need. I'll now summarize the closures for the next 2 weeks. There are to be no social events, festivals, and special events, arts and cultural events, sports, wedding and funeral receptions, or social events around those. There can be no in-person faith gatherings. Profit and not-for-profit fitness, recreation, sports facilities are closed. Sports, arts, and culture are not allowed for 2 weeks in any form. No practice or rehearsal, no competitions or performances. Indoor recreation businesses like bowling or movie theaters are closed. Business meetings and training are not permitted. Museums and libraries are closed. Personal service businesses like hair salons and spas are closed. Designated caregivers can continue to visit long-term care, but there will be no volunteers or visitors allowed in and no community access for residents. And for Nova Scotians who live in homes licensed by the Homes for Special Care Act, they are also not allowed community access for this 2-week period. These restrictions are not what we want, but they are what we need to regain control over the virus. And I'll close by talking about testing. Testing is an important part of our strategy. I'm very proud of the work that has been done to increase our ability to test broadly, and I'm proud of how Nova Scotians have answered the call. We are seeing our testing numbers reach new records every day. We tested almost about 20,000 Nova Scotians yesterday. That's almost as many people that were tested in Alberta yesterday, a province much larger than us. We have the highest per capita rate of testing in the country. But we are seeing some capacity challenges in some areas of the province, especially in Cape Breton and in HRM. Everyone wants a test, and that's good. And the health system is working as quickly as we can to add more pop-up rapid testing sites. But our priority must be to test those who are either symptomatic, those who have been to exposure site, or have been notified by public health because they're of a close contact. People with no symptoms are saying that they have symptoms to get a test in our online test booking. Please do not do that. It is causing delays for those who are critical that they get a test. We need your patience and your honesty. If you don't have symptoms, wait for an asymptomatic appointment or go to one of the walk-in pop-up clinics. And I know people are worried. I am too about this situation. And everyone wants to get tested, everyone wants to get vaccine. The health system is working as hard and as fast as we can to provide access to these necessary COVID responses. And I know that people have a lot of anxiety, and I've said it before, that one of the best things we can do to control our fear and anxiety is to focus on the things that we can do in our own behaviors. And so that focus right now has to be working together to drive the virus back so we can get on and finding a way out of this pandemic, which is through getting Nova Scotians vaccinated. So for the next 2 weeks, work from home if you can. Watch movies, play board games, go for walks, but stay close to home. Follow the rules we're putting in place. Please do, we want everybody roar back at the virus by being COVID safe. That's how we can show how much we care about each other and this amazing province we call home. And I'll repeat the phrase that I used the other day, lock arms and stay strong. Tina.
Thanks, Dr. Strang. Just a reminder, we'll take one question and one follow-up from reporters on the phone in the allotted time that we have for today's briefing. We do have a number of reporters on the line, so please keep your questions as brief as you can. We'll start with Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, there apparently is a presumptive case of COVID at Northwood in Halifax. Wondering if you can speak to that, talk about what is happening at Northwood to prevent spread there, given what happened in the first wave, and why is this particular case considered presumptive?
So I have no detail of that. I've been working on the details of release today. We have so many cases around that I am not on top of every individual case. So presumptive would be probably we have people that can test that it's an indeterminate result in the lab, and we have to repeat that test to get it confirmed whether it's positive or negative.
Go ahead, Natasha, with your follow-up.
Okay. Could either the Premier or Dr. Strang talk about the three people who are in the ICU, even give us a bit more information or detail about their age ranges? I think we heard yesterday there was one person in their 20s.
So that person I'm aware is still in the ICU. Again, I'm not top of all the details. There's so much going on, and we also have to be careful about what we disclose for privacy reasons. So all I know is we have three people in the ICU. One of them is the person we talked about yesterday.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thank you. Dr. Strang, just on the note, and perhaps the Premier also, on the note of a long-term care worker at Northwood who has potentially tested positive, given that you don't have 100% vaccination rates for long-term care workers, are you still comfortable with long-term care workers working at multiple sites, particularly in HRM, and if so, why?
So I'll answer your question, but I'm going to step back and say the long-term care actually gives me the least anxiety of our situation. We have high rates of coverage in residents, and we know that gives them good protection. We are working to increase the rates of vaccination in our staff. Across the province in this third wave, across the country in this third wave, where we've had outbreaks in long-term care, have had cases in long-term care, they have resulted in modest spread at best, and people have had very mild illness. That's simply the effect of the vaccine. It's why we made a priority, and our first priority route was to vaccinate in long-term care. So I'm not complacent, but it gives me the least anxiety of all the situations we're dealing with. I'm very comfortable that our long-term care facilities are well protected. And we know that, to your specific question, if restricting workers to one facility creates huge problems around staffing, around providing necessary care to long-term care residents, which has its own negative impacts on their health. So we try to minimize that, and certainly if we have an outbreak situation and a single case is not an outbreak, we do then restrict the movement of workers, but we're not in any of those situations at this point in time in the province.
Go ahead, Mike, with your follow-up.
Thank you. With regards to the essential service worker childcare options that are going to be set up, I'm wondering if one of you can provide some details to that. And Premier, could you address if whether or not this is a move in response to the fact that a year ago this wasn't set up and it created a problem for a number of healthcare workers in particular?
Well, certainly childcare is absolutely imperative for our healthcare workers. So there was, I think, challenges. I wasn't in this position at the time, but I am aware of significant challenges in the first wave, and so we're mindful of that, and we need to make sure that we're keeping our child care centers open like they did in Newfoundland and other areas where they looked at this circuit breaker approach. And we'll be there to support those that are having challenges to make sure that we have supports in place, especially for healthcare workers.
Next, we'll go to Elizabeth McSheffrey from Global. Go ahead, Elizabeth.
Thank you. On the topic of childcare, we've heard that there are cases of COVID inside childcare facilities. I'm wondering if, Dr. Strang, can you confirm that?
So we've had several daycares where they've had a case. It doesn't mean that the virus is being transmitted in in the daycare. It's people, whether staff or young children coming in from being exposed in the community. I'm aware, and I don't have all the details, but from one of my MOHs that we do have one daycare in the Halifax area where we're considering an outbreak within the daycare, but that's one daycare amongst hundreds of them across the province. So we do know that across the board that daycares remain a very safe place, and we have protocols in place for them. We're adding to those layers of safety by now requiring masking to be used of both staff and children in daycares as well.
Go ahead, Elizabeth, with your follow-up.
Still on daycares, is that daycare where there was an outbreak, is that one closed? Have any other daycares closed? And was the public notified about daycares where there have been cases?
So they're looking at whether they need to close that one daycare. When we have a case in a daycare, like we do in a school, there's a public notification to families and to staff. Those who need to know are informed.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, Prime Minister Trudeau announced today that the province had made a request for assistance, and he said that 60 military personnel are being sent to the province, I guess, to help with testing. Just for either one of you, I guess, how will they be utilized once they get on the ground, and when will they be in Nova Scotia to assist?
So my understanding is these are people coming from, I believe, Greenwood. There are already people in Nova Scotia, and I don't have the details, but how they're going to support some of our primary assessment centers in the various roles that it takes to run those assessment centers as we continue to build as much capacity as possible through those for Nova Scotians to get a test.
And I just want to thank the federal government for stepping up. I know they're helping some other provinces, but this is an area that, as Dr. Strang referenced, the high testing that we're doing, more per capita than frankly anywhere else. We want to keep that up. So those 60 individuals will be focused on that testing and allow us to continue that growth of capacity of testing. So I want to just thank the federal government for that.
Go ahead, Keith, with your follow-up.
And Dr. Strang, based on your modeling and the way the variant seems to be multiplying, are we in for another few days, or maybe even another a week to a couple of weeks of large numbers? Or if this takes hold, should we get this under control fairly relatively quickly?
So we're hopeful that it will. You've heard me say here a number of times in the last few days that I expected to see numbers increasing over the weekend into this week. We only put restrictions in place on Friday, so the behaviors and how people got exposed that were the cases we're seeing in the last 24 hours. Those were things that were happening before we put restrictions in place. But because of what we're seeing, the speed of the spread even within Halifax and the concerns about spreading now outside of Halifax, that we need to take aggressive action and things have changed even in the last 24 hours. We were in front of you yesterday talking about a level of restrictions that are outside of HRM. We're now going beyond that because the speed of things and the concern about what we need to do to keep us well out in front of this virus to bring it under control. So we're acting even more aggressively today, and I firmly believe that what we're doing is the necessary and right things that will start to see the impact of this over the next couple of weeks.
Next, we'll go to Maude Matambo, Radio-Canada. Go ahead, Maude.
Hi, bonjour. My question, why don't we impose a curfew knowing that this measure is being very effective elsewhere, like in Quebec, for example?
Well, I think the curfew is in place to prevent people from not following the orders. We have a form of shutdown right now. Our businesses, unless they're essential, will shut down. But as I said in the past, we won't hesitate to use any measure required, but at this point it wasn't deemed necessary. We do think most Nova Scotians understand the seriousness of this and staying home and restricting the movement of their activity. We'll see how they follow these orders.
Go ahead, Maude, with your follow-up.
Could it be the next step?
Well, I'd like to have confidence in Nova Scotians to follow what we've brought forward in the last couple of days, and that's how we've been able to beat this virus before. There's no question that variants are more serious. They're attacking young people, so that's why we're taking measures that are getting out in front of this, beyond HRM even, to make sure that we're taking that approach. But again, we won't hesitate to use whatever means that we need to do. I do have confidence that Nova Scotians, by and large, will follow these orders.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead, Nabal.
Good afternoon. So as we're seeing more people in hospital and in the ICU, I was wondering if you can tell us more about how the province is preparing for an increase in hospitalization.
So I certainly know my colleagues in the healthcare system we're decreasing some of our less essential day surgeries, outpatient clinics for two reasons. One, so we can be prepared for the possibility of having more patients with COVID in our hospitals, but also we need more staff to be redeployed to support the lab, to support testing, and those important functions across the province. So yes, we are bringing down work in other parts of the healthcare system to make sure we can focus on the necessary COVID response.
Go ahead, Nabal, with your follow-up.
Are there other measures that we're taking outside canceling the elective surgery?
Well, I said there's elective surgeries, outpatient clinics, slowing down work in other non-COVID related care. Always being cognizant that there are people with critical health care needs that we need to support as well. So I'm not directly involved in those conversations. There's many other folks and groups of teams in the healthcare system working out all the details of that. But absolutely, we are decreasing what we call capacity and functioning in other parts of the health system to make sure that we have the right resources to deploy to the various components of the COVID response within healthcare.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you so much. Premier Rankin, given this tight closure that's required to slow our outbreak, I'm wondering what small businesses and service sector workers can expect in terms of support. I'm hearing from some small businesses who fear they won't be able to reopen.
Yeah, no. I know there's going to be an impact on businesses now across the province, not only HRM. We're fully aware that we'll need to step up and support them, and our departments of inclusive economic growth have been working around the clock, contacting associations. I think that we'll have some more details later on this week, but it's going to impact people. We know that. We take this very seriously, and that's why we'll be there to support them with the Small Business Impact Grant, and we'll look at other opportunities to make sure that they're not as impacted as they would be.
Go ahead, Lindsay, with your follow-up.
Thank you. I appreciate that. I'm wondering if you can give any more information on that news that's coming later this week. I recognize that it's all happening very quickly, but can you sort of give an example of what type of added support or what would be different that small businesses can expect?
So we'll start with what the program was in place the first round. So I do know we've reached out to Dalhousie, that team that administered the last fund. We'll replenish the fund with the required amounts to make sure that we're reaching all of those sectors impacted. There's restaurants, there's all those businesses that aren't deemed essential will need support. So that's just one program that worked. There's still federal supports out there that employees can access, and what the province does is try to fill those gaps, and just want to assure businesses that our teams are working around the clock to make sure we're prepared for that.
Next, we'll go to Daryl Cole from Saltwire. Go ahead, Daryl, if you're there.
Yeah, good afternoon. My question's for the Premier. The last few Sundays, I've been out to the border. There have been protests. The people expressing frustration if they can't visit family members in each other's province. And understanding the measures that were announced today, and last Sunday there was a blockade. We actually closed the border for more than an hour. I guess, what message would you have, Mr. Premier, for those people who have been cut off from their families since last November?
Well, I certainly can understand the challenges of not being able to see family members. But what we're asking for in this scenario, if all goes well, this 2-week period of time, if we restrict ourselves, the more that we can listen to what we're trying to do now, the better off we'll be. If we want to have a decent summer and we let the vaccines catch up, if we can continue to work with Nova Scotians and stay home, stick to our family or just that limited amount of people that we're seeing regularly, I think that we'll be in a much better place. And if they could just think about others that would be impacted if we were to open up the border. It wasn't easy for us a week ago to make that decision that people couldn't enter our province unless it was essential. But we know that variants came into this province from out of province. So that was early action that we thought was necessary, and you can just see the proof of how quickly this can spread. It's spread throughout Halifax Regional Municipality at a rapid pace. We're trying really hard to prevent that happening across the province. So these measures are extremely important, and I would just ask those that are fighting against these measures to just please understand that they're not easy for us to put in place, but public health deems them necessary, and the faster that we can get this in control, the more closer that we're going to be back to normal.
Go ahead, Daryl, with your follow-up.
The second question is also for the Premier. Last week, New Brunswick government put some new rules in effect for cross-border workers, and that includes a number of healthcare workers that work at the healthcare center in Cumberland County near Amherst. A large percentage of the doctors, nurses, specialists that work at that hospital live in New Brunswick. Are you concerned this could affect healthcare in Cumberland County, and are you talking to New Brunswick to see if there's anything that can be done?
I am concerned, and I have sent a letter to the Premier of New Brunswick. We have a call with our fellow premiers of Atlantic, and it's something that I do want to speak to him about. Our Minister of Health has also reached out over those concerns. We believe healthcare workers who are essential and are vaccinated as well should be, at least one dose should be able to go over that border to make sure that we keep our health care system running appropriately, and so I look forward to those discussions.
Next, we'll go to Chelsea Gould from the Truro Daily News. Go ahead, Chelsea.
Hello, Dr. Strang. My question has to do with the time it takes to issue a potential exposure notice. For example, Truro Starbucks closed Friday night for cleaning but wasn't listed until Monday night. And a golf course in Yarmouth closed Saturday and still under investigation, but it's not listed at the moment. So investigators are obviously busy, but can you give me an understanding of how long it can take to determine from a risk assessment perspective whether or not to issue a public notice and why that is?
So I think we have to be aware of the case, and then we have to follow up, interview the case, find out all the places they were, and then do that risk assessment, and that takes a bit of time. Clearly, with the volume of cases we're seeing, public health is being challenged to keep up with all our work in the time that we would deem to be that would be ideal. Our first priority is to make sure we get in contact with every case within 24 hours, but then to deal with all the understanding, all the taking that information and turning into things like public notifications. Clearly, we are slower than would be ideal. It's just a simple fact of the volume of cases that we're dealing with, and that's one of the reasons why we need to act now and bring things back under control. Public health is absolutely stretched to the max. Our testing capacity is stretched as far as we can go. We're looking at innovative ways, but we have to acknowledge that our healthcare system is already beginning to be impacted. So we need everybody to understand that they need to do what they can do to help us in the healthcare system out and bring the virus back under control.
Go ahead, Chelsea, with your follow-up.
Thank you. Some businesses take extra precaution to alert people, for example, on social media, before the sites get listed about the reasons why they're closed. What do you think about that, and would you encourage that?
I think anything we can do to say if a business becomes aware and say you might have been exposed, that you monitor your symptoms, like our message is everybody go get tested. If businesses can help support, get that message out, all the better.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi. Dr. Strang, there's been large numbers of children who have tested positive 30 were announced today, 20 yesterday. They're among the highest number of age cohorts right after the next group up, 20 to 39. Does this reflect widespread spread in schools?
No, we doesn't reflect. We've had a few cases where we've had some one or two secondary cases in the classroom. What it does reflect, Tim, is that widespread exposures out in the community.
Go ahead, Tim, with your follow-up.
Yeah, I have a question about school reporting. Yesterday, for example, I know for certain several people shared with me that there was a notice sent to the Dartmouth High community saying there was an exposure, that there was a case there, but it wasn't released, and the department tells us they're no longer telling the broader public. So why is it that when I go to the Scotia Square food court and someone had been there a few days before who had tested positive, I have to go get a test, and I don't have a problem with that. I'm alerted to it. But when a student who has been at a school has tested positive, the school community is not now alerted to go get a test. So why that difference?
So as far as I'm aware, we're still communicating out to for different schools through their mechanisms to students and staff within the school. But I think everybody in HRM especially should be working under the premise that if you're out and about in the public or any places, there's a chance you might have been exposed to COVID, and you should be thinking about getting tested regularly and not relying just on being notified by somebody that you could have been exposed.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. I'm wondering, Dr. Strang, if you can give a little bit more detail on essential services and which retail stores will have to close, or whether any can, is there an essential service? Does that mean they can remain open for the whole store? For example, a grocery store that also has like a clothing section, or we saw in Ontario, for example, that essential service aisles excluded things like toilet paper at the dollar store or food at different places because that part of the store wasn't deemed essential.
So we got people in the Department of Business and others who are working in those details now. We made this decision and are moving very rapidly. We're announcing it. Certainly, that list that I gave in my remarks of those 10 types of consumer products, a store that is selling those is allowed to have people come in and in-store purchases, and the details of what parts of the store, those are going to be worked out. But all other stores, if they're not on that list, then they cannot have in-store purchase.
Go ahead, Victoria, with your follow-up.
Thanks. And I'm just wondering, I got the email with the info about daycare assistance for essential workers, help finding childcare. I'm wondering what the capacity is for that. If either of you could answer, how many children will be able to be provided childcare under this thing.
That's an answer we'll have to get back to you from Department of Education, Early Childhood Development. Again, they're working on a lot of details very quickly, and so we'll have to get back to you with that.
Next, we'll go to Pat Healy from the Laker. Go ahead, Pat.
Hi, this question is for Dr. Strang. Residents from Emsdale, Lance, and Fall River have spoken to me about being nervous to go to Truro or Halifax for testing as it's outside their community. They're wondering why there is no testing in East Hants or Fall River. What can you say to them as to why that is?
So it's simply a capacity issue, as well as where is there a good location to actually have a testing site. So recognizing that, but certainly people can go, in fairly close communities. People are very easily going, from outside of, I live in Fall River. People travel all the time to go shopping in various areas. So there is testing capacity that's not very far away, but we only have so much capacity to just stand up so many sites.
Go ahead, Pat, with your follow-up.
Knowing this circuit breaker was likely a last resort, can you give us some insight into what the decision-making process was like?
We a lot of the last 24 hours. This is, that you've seen all the announcements we've made. Things have progressed very rapidly, and we continue to have to think about what's the next set of restrictions and when do we put them in place. There's a lot of discussion and thinking that goes into that, but we don't have the luxury of time. So that there's a lot of pressure, but but we have to make some decisions, and I believe we're making the right decisions. I'm very confident that what we're putting in place will have the impact, but it requires the cooperation of every single Nova Scotian to get the desired effect.
I just want to thank the team, Dr. Strang, of course, but he has a mighty team behind him that are working. We're pushing very hard to get the right restrictions in place. So over the last few days, we've been on the phone nonstop, working through exactly where we need to go to stop this trend of increased cases, not only in Halifax, and again, trying to keep it contained. So I just want to thank those workers behind the scenes.
We'll take one last question from Preston Mulligan from CBC. Go ahead, Preston.
Hi, thanks. Question for Dr. Strang. I found out today that about 168 employees at Nova Scotia Health, the Nova Scotia Health Authority in the capital area, the Halifax area, are either symptomatic, are waiting on a COVID test, or they're asymptomatic and they have to isolate because they were exposed. So it's 168 employees. How concerned are you from public health, or should we be at that number, and do you expect it to grow?
So there is a concern. That's one of the things. That's one of the reasons the healthcare system is under pressure. It's one of the reasons why our school system is under pressure. With widespread of the virus, lots and lots of people have to be isolated, either while they're waiting for a test or, if it's a higher risk of exposure, for a full 14 days. It starts to create substantive pressures on the critical components of that are important to our society. So it's all that's the reason, or one of the critical reasons why we're acting now, that our healthcare system is already under pressure, our education system is under pressure. We need to get out in front of this again. But again, I keep coming back to every Nova Scotian then has to take this extremely seriously. We can put all the restrictions and everything in place, but it's up to every Nova Scotian to follow those and to do everything they can do to keep each other safe.
Go ahead, Preston, with your follow-up.
Yeah, my follow-up is about vaccines. There was a pharmacy that notified the public that they don't have any appointments. They were wide open today. And what do you think of that? And also, had you given any thought at all to changing the strategy or the rollout for vaccines at this point, given the situation we're in right now?
So, we had a bit of a slowdown this week and next week simply because the Moderna we were expecting has been delayed. So we have a little less capacity than we wanted to. And there's been some, we've had to remove some appointments. We're not looking at changing our strategy. That we have to have the fastest strategy that will get the vaccine into people's arms as quickly as possible. We have shown in the last 2 to 3 weeks of how rapidly we can progress through age groups following an age-based process. And so we're not going to be pushed off target on that age-based process. We cannot be put into a position where we have to slow down vaccination to adopt a different process. It's critical. The next few weeks are critically important that we continue to deliver vaccine at the fastest rate possible, because it's the other side of the coin, if you will, that gets us to the place where we have COVID back under control.
That's all the time we have for questions. Go ahead, Premier.
Thank you. We are at a precarious point in our province. COVID is making a comeback, and we need to do everything we can to shut it down. That's why we are tightening up. Some of you may be thinking that your community barely has a case of COVID. But my worry as your Premier is that without these measures, COVID can seep in quickly. And the variants have complicated matters. They are more aggressive, and they are attacking younger people. I know we are asking a lot, but today's measures are exactly the approach that made us successful in the first 2 waves. We closed quickly and extensively, and today we are doing the same thing. It worked before, and we are confident it can work again. But it'll only work with your help. Dr. Strang and I need you now more than ever. Your strength, your resolve, your love and kindness for one another. That's how we will get through this, together.